डोज के संदर्भ में हमारे एक्सपर्ट टीम ही तय करेगी और जो भी मार्गदर्शन हमारे एक्सपर्ट और साइंटिफिक हमें मार्गदर्शन मिलेगा, ये साइंटिफिक मार्गदर्शन के आधार पर हम आगे चलेंगे.
When we have enough vaccine and when there is I read news reports, I don't know that 22 crore vaccines are nearing expiry. Now, if that is true, we should use the booster.
Watching News Epicenter with me, Maria Shakil. There is a red alert across the country after 2 cases of the Omicron variant were detected in Karnataka. One is a 66-year-old South African national who visited Bengaluru for a business trip, and the other is a 46-year-old health worker. As contact tracing continues to isolate and track primary and secondary contacts, big questions remain unanswered over the second case, as the healthcare worker had no travel history. How did he contract the Omicron variant? Prompted by fears of an outbreak, the Karnataka government has tightened COVID protocols in the state. Now only fully vaccinated individuals will be allowed inside malls and cinema theatres, while negative reports are mandatory for all foreign travellers, not only from those countries which have been listed as at risk. However, standard COVID protocols continue to be flouted across the country, with no masks, no social distancing, and crowds in public places. Right on your television screens, those are the images, creating a fertile ground for the variant. With the virus in a constant state of mutation, does India need an additional shield? Over 10 nations have cleared booster doses, and is it time for India to do the same? There are a number of unanswered questions when it comes to Omicron. To decode the science and protocols, we are being joined by nation's top COVID experts. Dr. Jayaprakash Mulyal is epidemiologist, Dr. Raman Gangakhetkar, former chief epidemiologist of ICMR, Dr. Ashok Seth, chairman of Fortis Scott's Heart Institute. Thank you so much for your time here, everybody. Dr. Mulyal, microbiologists and scientists world over are still trying to find out more about this virus. Tell us, sir, what do we know about it then?
At the moment, we know that it seems to have existed here, at least in one individual. And as you can imagine, it is difficult to draw conclusions. But in taking care of how to proceed, we need to be quite logical. The question is this variant an immune escape mutant? That is the evidence we should seek. Indians are fortunate in one way that most of the protection of the people came from natural infection. We paid a heavy price, but that's what we have. A natural infection produces excellent immunity. The question is, will this new bug follow the law? If it does not, then we are in trouble. And if it does not, no vaccine will also help.
Then in that case, Dr. Mulyal, how long do we have to wait for the full picture to emerge? For all the questions that you asked to be answered?
Not very difficult. We are going to look for large amount of reinfection. Now, to give you a clue how we go about designing the studies, for example, during the Delta wave, second wave, certain areas like, urban slums in big cities never had any cases. Why? Because they had undergone the first wave and were largely protected. Delta followed the game plan, that is, they will ignore people who have been infected. And they also responded. He also dealt decently with those who are vaccinated. Similarly, we can get both hospital-based
Hmm.
and field-based data rather quickly in
Okay.
terms of is there evidence of any new outbreak. That's where we should look for,
Okay.
because we can't keep on, shooting in the dark. Remember, this is not the last of the variants. New ones will keep emerging.
Hmm.
What do you do then? So I think we should proceed systematically with quite a lot of confidence. Now, confidence in the sense that we have done a good job so far in vaccinating. Despite a high level of immunity, more than 100 crore of people had received vaccination.
Okay.
So when you look in a bulk, the country is safe. So we have time to think about how to proceed. There is no need to jump into strategies which are unscientific.
Okay. Dr. Ganga Khetkar, in that case, of course, the genome sequencing will reveal if Omicron is causing the infections. Also, they will see if the infections are severe in nature and whether fully vaccinated people are also contracting the infection. Then what does this 30 mutations of Omicron actually mean?
No, we need to
What
understand
we
one
did
thing,
was we
that the
counted the number of
vaccines,
mutations
Yes, that's a
and
question
said,
to
oh my God,
Dr.
this
Raman
is
Ganga
going to
Khetkar.
cause problems.
Sir, that's a question to
But-
Dr. Raman Ganga Khetkar, please. Yes.
Sorry.
Go ahead.
what I would say is, we know the vaccines that we have developed as first generation vaccines, they are efficient in reducing the severity of the disease and the subsequent hospitalization or death. But when it comes to preventing infections, these vaccines fall short. So essentially, you will always see infections occurring in the population even if they are vaccinated. But does that pose a threat to their health, or would it put stress over the health systems? Perhaps it is not going to do that. And therefore, provision of vaccines is a critical issue. And at the same time, if you want to prevent occurrence of infection, perhaps what would be most important to stress is the COVID appropriate behavior which has to be followed. I fully agree with Dr. JP Mulil, who was hinting that perhaps a hybrid immunity, the infection that occurred from Delta and the vaccines that we are providing, may have longer lasting impact. But most of these things are purely speculative as of now.
Okay.
It is time we should put our heads together and try to generate some kind of evidence over which we can strategize what we would like to do.
Okay, then does it cause more severe disease? Do we have an answer to this one, Dr. Ganga Khetkar?
Which one? No, I couldn't hear. I don't know.
Does Omicron cause more severe disease? Do we have an answer to this question?
Which question?
Does it cause more severe disease? Does it make it worse?
Severe disease? No. As of now, for Omicron, we know that we don't have evidence, and it is important that we communicate that fact. We don't know whether it increases virulence, it increases severity, it increases hospitalization or death. But it would be good for all of us to keep in the mind that even if it is, we need to presume that every infection that is occurring is Omicron, and perhaps it may lead to increase in severity. We need to hasten the vaccination process and at the same time ensure that we follow COVID appropriate behavior. Perhaps that's the best way out, because these infections will keep on coming, new and newer variants will come. We need to understand how they are going to behave biologically before we actually take steps. So there should be no panic, just a caution in place.
Okay, then Dr. Seth, South African scientists have said that about 40% of the population have the coronavirus in the past, and about 30% has been at least partially vaccinated, and yet the number of new cases is soaring. What does it actually mean then?
So I'll just address some of the points which are raised in relation to this, what you said, and then move ahead. Firstly, of course, that while in the laboratory, this virus has so many, unprecedented number of mutations, and we know enough about the Omicron. On the clinical front, as to its effects, what is known clearly is that it is more infective. It is at least 4 to 5 times more infective than Delta. There's no doubt about that. The second point, does it evade immunity? And by the way, today itself, the South African physicians and their official body has clearly reported that they see a major proportion of these infections in those who've previously been infected with coronavirus.
Yes.
And therefore, it is evading the immunity of naturally acquired infection. What is still not known is whether it will evade the immunity of vaccine-acquired immunity, which is thought to be more predictive and more durable theoretically. But finally, the severity issue is the most important, because if the virus is only mild, as is seen in early stages of the disease, then perhaps the healthcare system doesn't get inundated, and actually then it doesn't become such a huge national issue. But must remember that that is the one which is critical and most important as a clinician, I tell you, because that is what is seen in 2 and 3 weeks' time rather than today itself. So while earlier reports said it's a minor infection, we don't know how it matures, because most of the complications and severity of COVID illnesses, as you remember and recall, occur from 8th to 12th day of the infections, and that is what we are sort of, cautiously waiting for. In that instance, what we must remember, you have actually said the right things. Everybody said that double vaccination, by the way, double vaccination till now has prevented us from severe illnesses, from severe pneumonias, from going on to ventilator and death in all the variants which have been sealed till now, including the Delta variant. Okay. So it is important for us to be double vaccinated, and those who haven't been must make sure that there is still going to be some protection offered. It is not going to offer protection against reinfection, or it may not offer against that, but it's certainly going to offer against, most likely against, severe disease and death. And finally, of course, we have our own important vaccine, which is our social distancing, our double masking. This is the time for double masking. We must remember that as we go out in the community, we've been wearing cloth masks and we've been becoming careless and callous about it. In fact, a surgical 3-ply mask inside with a cloth mask outside protects us with a close to 95% protection. And for healthcare workers and frontline workers, of course, it's N95 which will protect us.
Okay.
If we do that, then we are protected. Both of it is important in the present times.
Okay. Then in that case, Dr. Mulial, the swift rise in the number of infections hints certainly at Omicron's power to overcome immunity. Do you think booster dose is an answer to that then?
I said it not so nicely. Let me explain to you. If all the vaccines that are derived now are from the original virus, and that particular immunity is not being recognized by the new virus, how can booster dose work? I do not know. But I'm not an immunologist, I'm only an epidemiologist. Okay? Now, so it is a critical issue now. We have to watch carefully. And the thing is, at the moment, there's a lot of effort going on controlling the virus and identifying. We also should start quick observational study based on healthcare workers and high-risk areas like slum to see if there is an outbreak. That's the only way evidence that supports this kind of a thing can be generated.
But this entire question of reinfection that has happened in South Africa, is this because of the new variant? Do we have an answer to this?
If there is the rate of reinfection has so far been extremely low. And if I were to believe what South African reports say, there is no study at all. These are impressions. I have not seen any data. Following vaccine, we do get breakthrough infection. However, they are mild. And like Dr. Seth said, the key issue is, will it make people very sick and cause fatality? This is a crucial question. Anyway, a systematic approach has to be initiated, and it looks like there is a kind of panic, which is never a good way to deal with situation like this. We have the expertise and we should be able to deal with it in a short time.
Okay. Dr. Ganga Khetkar, are we staring at an imminent third wave then?
I don't know what one would call as third wave.
It's a possibility.
If you
sorry.
Yes, go ahead, Dr. Ganga Khetkar. Yes.
No, if you actually look at
whom should answer?
I have been repeating.
Yes, please.
Hello.
Go ahead. Yes.
As I have been repeating again. If you provide vaccine, it prevents the severity. It prevents severe COVID disease, hospitalization, and death. But when it comes to prevention of infection, it tends to have far lesser efficacy, which would essentially mean that you are to expect these infections to keep on increasing if I actually measure asymptomatic or mild illnesses as well. And one example that I would give is when people talk about reinfection and reinfection rate, most often they are referring to symptomatic infections, whether mild, moderate, or whatever that one would think of when it comes to reinfection. But you don't measure the asymptomatic infections that occur because it poses many challenges in conducting research in that. So if I'm going to measure in terms of third wave, in terms of new infections that occur daily, it is possible that your numbers could come out as high if the infection tends to be of mild variety, which is also reported by people. But if it comes today, when you have passed almost 2 years into this particular pandemic, what is needed is not measuring the daily new infections as an evidence for a third wave, but you would like to actually measure or give primacy more to the number of hospitalizations that occur, number of deaths that tend to occur every day. That would be a better monitoring point. Do we think that there could be a third wave kind of thing happening if this virus has a higher transmission efficiency? This variant is likely to spread rapidly, and the more we will test, even those who may be contacts, you will find that even if they are asymptomatic, they may come out as positive. So what you should consider as third wave is an issue which we have to decide. It should always be at this stage of this pandemic, when risk mitigation strategies are important, we need to give primacy to daily new hospitalizations and daily deaths, to my mind. And I don't see that we have sufficient data to say that they are likely to increase, though numbers may essentially increase.
Dr. Seth, we are looking at the kind of reports that are emerging from South Africa, and they are talking about a specific demographic which is being infected by this Omicron virus. This is largely the age group which is supposed to be under 30, and also the children who are unvaccinated, of course, have become victims of this virus.
You're right about those reports. And yes, there's been a proportion of children who've been admitted and then elderlies who've been admitted. But it still doesn't tell us whether they were severe or was it just a diagnosis. We must remember that it is very important to analyze this in terms of mild infection or asymptomatic individuals versus serious infection requiring hospital admissions, proceeding to ventilation, lung infections, oxygen supply, and perhaps death. The difference is that mild infections and minor infections, by the way, may happen with this virus, which multiplies hugely, but in a sense is nothing wrong. We see that with H1N1, which actually many people have and get better. We see that with flu also every year, which many people have and get better. In fact, it creates an innate immunity and a high percentage of seropositivity. So that's not what we worried about. When we talk about the third wave, we're talking about whether it will lead to hospitalization and severe infection, and the hospital systems or healthcare systems getting strained. So as far as children are concerned, we're not going to shift our focus in a way to saying children are getting severe infections. No, but as long as we take COVID appropriate precautions, we're going to be able to protect everyone. I want people to understand that there is no panic in whatever we're talking. This is proactiveness, this is precaution. And by the way, this is the right time, I would say, that a roadmap should be set for even booster doses or a third dose, by the way. And I want to differentiate the third dose from a booster dose. There are individuals in our community, patients who've got cancer, transplant recipients, elderlies with low immunity, who actually have not even developed innate antibodies related to the 2 doses. It is well recognized. These are the persons who require an additional dose, and that is a must. As far as boosters concerned, we're talking about those who already got immunity and that may be waning. But this is the time to create a roadmap. If we created a roadmap for vaccination, I think it's appropriate time, and I'm sure the government is looking at it, to create a roadmap for booster dosing, at least of the very susceptible population, like the elderly, like the frontline healthcare workers, like the frontline workers who've actually been 8 to 10 months past their second doses. Right. And it might be actually the right time to look at that in a fair number, because we have enough vaccinations available. And on one hand, there is a vaccine hesitancy. On the other hand, they may be getting vaccinations which are a surplus in the near future.
Let me give the final words to Dr. Mulyal. Dr. Mulyal, how worried are you about the current developments?
I am not really worried about this, because the story is very, very flimsy. Okay, now we have gone through this. Delta was quite bad, unbelievably severe. Now, is this the same thing is the question. And till now, even from listening to South African officials, it has generally been mild illness. But I have no guarantees on it, because again, we are working on flimsy evidence. So in terms of worrying about our safety of our people, I think we are in a different situation. We have faced an epidemic, a two-way, large percentage got infected, and we have also done a good job vaccinating in terms of number of people got vaccinated in our effort. So this is the biggest effort we have ever done. So I think I'm not asking everybody to relax. I'm saying what we do, this should be based on pure science and should design efforts to get information so we can interpret it and act accordingly. Okay. And what is good for UK is not the right one for us. Yes. We have to think for ourselves.
Okay. Okay, so what is, of course, one size fits all doesn't really apply in this virus. We have seen how it reacts differently in different countries. Dr. Ganga Khetkar, exactly 30 seconds for you. The same question that I asked Dr. Mulyal, how worried are you?
No, I think I don't have sufficient evidence to say that I need to get worried. Neither do I have evidence to say that there would be no worry. I think what we need to do is just stay cautious as of now, ensure that we look at the evidence that tends to emerge seriously, and try and understand from this particular evidence that would be generated maybe in next 1 week's time. You might find that we will be able to take position whether it is likely to pose a threat to the health infrastructure or it does not.
All right. Dr. Ganga Khetkar, Dr. Seth and Dr. Mulyal, always a pleasure to speak to you. Thank you for sharing your thoughts. Of course, there are a number of unanswered questions. We'll have to wait for another perhaps 3 to 4 weeks for the picture to emerge clearly as to how difficult this virus is going to be on the population, particularly here in India. That's all from me. Thanks so much for watching.